Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
Hello, I'm Matthew Kaufenberg. I'm a physical therapist and I own Back in Motion Physical Therapy in Perham, Minnesota, as well as Park Rapids, Minnesota. Today I thought I'd talk about the SI joint, which is the sacroiliac joint. It's another potential source of low back pain. There are so many sources of pain in the low back. We've talked about a few in previous episodes. Today I thought I would just focus a little bit on the SI, or the sacroiliac joint. Most people who are going to have sacroiliac joint pain are going to describe pain usually with movement. Like if they're turning in bed, they'll feel some pain, or if they're getting up from a seated position, they'll feel pain. A lot of times when they're walking, when they try to swing their leg, they'll feel some discomfort, or when they land on that leg, they'll feel discomfort. And typically the discomfort, most people with SI joint pain will be very localized and say, man, my pain is right there. A lot of times it can be like quarter size, 50-cent size pain, but it's often just right in that region, and they'll feel it when they're trying to swing their leg. They'll feel it right there, or when they're turning in bed, they'll feel that pain. So what is the sacroiliac joint? So if we look at the spine, the very bottom last portion of the spine is actually our sacrum, and it kind of looks like a triangle. So this is called our sacrum. And then this large hip region, so that bone that you feel on the side, that's called your pelvis. The top part of the pelvis is called your ilium. So where the sacrum and the ilium meet, which is right in here, where they meet, that is called your SI joint, or your sacroiliac joint. Now there are some really, really thick ligaments that are going to hold those two bones together. Those ligaments sometimes can get sprained and cause some pain. There's also a really thick ligament that'll run from the ilium up into the top part of what's called our lumbar spine. That can be a source of pain. Both of those would be considered SI joint pain. Typically, however, the SI joint pain is going to be from a muscle, and that muscle is usually the piriformis muscle. The piriformis muscle is going to run from your hip. So you're going to have your hip here, and then the piriformis muscle is going to run up and attach into the side of the sacrum. It's basically going to lay just like that. That muscle will often go into spasm. It'll tighten involuntarily, and people will get this type of pain. So I wanted to show you a quick way that I examine patients with SI joint pain, and then show you just a couple of treatment techniques that I would use. So I'm going to go ahead and bring in someone to kind of do these examinations with you. Okay, so we're going to show you just a very, very quick examination of what we would do for someone with an SI joint problem. The SI joint, like I say, it can be ligamentous, it can be muscular, but usually what will happen is we will see the SI joint not moving properly. So when someone kind of slumps forward, the SI joint should actually move backwards. When we have someone sit up really tall or extend backwards, the SI joint will actually move forward. And we can feel that. So what as part of the examination, is I'll palpate the SI joint and I'll make sure that it's moving properly. Usually if that piriformis muscle is spasmed, the SI joint won't move properly, and what will happen when somebody maybe slumps down, instead of both sides falling forward, one side will be held back because that piriformis is holding it, and the other side will actually do what it's supposed to, and it ends up looking like the SI joint is rotated. So the way that we examine that is what we do is we find what's called the sacral base, and those are like little indentations that we all have. And I basically just put my thumbs in those regions. Then I would ask my patient to go ahead and sit up really, really tall, and then go ahead and slump back down. And what I'm looking for, what I'm feeling, it's more of a feel than a look. What I'm feeling for is that SI joint actually doing its movement? So when you sit up really, really tall, the SI joint is supposed to pop backwards. If only one side pops backwards, one thumb's going to come back and the other one's going to stay. And it's going to look like that joint is rotated. And also in the same way, when you slump, that SI joint, when we kind of flex, the SI joint is supposed to also move. And I'm checking to see if one thumb is, the thumbs are supposed to be equal. If they're not, one thumb's going to be more posterior or more closer to me. So that gives me an idea that number one, the SI joint is not moving properly. Go ahead and lie down on your back. Then there's 5 really, really quick tests. And the reason we do these tests is because there was a great study that was done that showed that if 3 out of these tests were positive for reproducing someone's pain, it can be guaranteed that it's an SI joint problem. So what we do is we find the pelvic bone, and we literally just push down. We're almost distracting it. And we push fairly hard, and I push straight down pretty hard. And then I would ask him, do you feel pain? And if he says yes, then I'd ask him where he feels the pain. And it has to be right in that one spot that we were talking about. Okay, go ahead and scoot towards me. So stay on your back, but just kind of scoot towards me. The second piece is to let one leg hang over the edge. The other leg is going to go ahead and bend that knee. And what we do is a fairly quick thrust where I bring that leg in that direction while I push this leg down. And again, we're just trying to reproduce that pain. Again, if the patient says, yes, I felt that pain in that spot, that would be a positive test. Okay, kind of scoot back into the middle. Then we would bring the knee or the hip up to about a 90-degree angle, and we literally just kind of push straight down. I'm pushing straight down, looking for reproduction of symptoms again. If that pain is in that area, positive sign. Okay. Go ahead and lie down on this side. Fourth test that we do is a straight compression down. Again, find that pelvic bone, and we push straight down, looking for reproduction of symptoms right in that spot. And then lie down on your stomach. And the final piece of the examination, again, this is just for SI joint. You place your hand on the SI joint and you push straight down. Again, looking for reproduction of symptoms. If 3 out of those tests are positive, you have about a 90% certainty that it's an SI joint pain. Once you know it's SI joint pain, you send them home with very specific instructions and exercises to do. And then we would also do a treatment in the clinic. I'm going to show you one example of one treatment. Lie down on your right side. What we tend to do in the clinic is what are called muscle energy techniques. So if we come over here, so let's say it's a left-sided problem and that piriformis muscle is spasmed, it's holding tight, it's gripping. Well, you got to get that spasm to release. So one thing we'll do is we'll do what's called dry needling. We'll put needles right into that muscle to release it. We'll also do what's called a muscle energy technique. A muscle energy technique is actually contracting the opposite side. So you want to contract the opposite side piriformis. When you contract that, you actually get a neurological input and feedback that causes the muscle on the opposite side to relax. They're very simple techniques, comfortable techniques that are very effective to get the piriformis to relax. Okay, so what we do is we get the patient in a very specific position. So I'm palpating his SI joint, and I'm moving his hips until I feel movement right at that SI joint. Find movement. Raise the hip up again to find movement right at that SI joint. Once you feel movement, you stop. Okay, and then I'm going to have you, Noah, just go ahead and rotate your body back that direction. And as he rotates, I hold him and go ahead and stop there. And then I just say, go ahead and hold your leg. I'm going to let go, hold the leg. You're now getting a very specific contraction on this side to get a right-sided SI joint problem to release and relax. Excellent. Thank you very much. And again, we would then send a patient home with very specific piriformis stretches and some very specific strengthening activities. If any of you suspect you may have an SI joint problem, please give me a call, 218-346-2464.
Hi, I'm Liz Kwapala with Mojave Ottawa Community Action Partnership. I'm excited to just give you a little update about where we're at in this new world of COVID-19. So we're still primarily working from home. Our Head Start centers have started welcoming children back. We're doing summer camp right now to try to get the folks who are going to kindergarten some classroom experience. So that's been really fun to see and to have the children back. Our family health program, family planning has been, we've been seeing patients the entire time, so those clinics are still open. But otherwise, we're still doing work from home. I know just call and leave a voicemail. We've got drop boxes at the front doors. Leave us notes or applications and we'll get those processed right away. Our staff are working really hard and very flexibly to make things happen. Now with the new face mask mandate, we're just really concerned and wondering if folks have access to a mask. If you don't, we'd like to help you figure that out. And we'd like to see if there's a role we can play in helping get you a mask so that you can go about doing your business. So if you don't have a mask or someone in your family doesn't have a mask, give us a call and we'll see what we don't have a stack right now to hand out, but if we can play a role in facilitating that, we'd like to do it. We just don't have a sense right now of how many people still need a mask and don't have one. So if there's anything we can do with that, please let us know. On COVID as well, we're just very aware of the stress it's causing, just concern for friends and family and neighbors and the economy, the stress it's causing to all of us. And so just really want to encourage you to check in with each other, with relatives you haven't maybe seen in a while, socially distance, of course, over the phone or over the video, computer, whatever you can do. But just this social connection is so important. And the physical distancing, I think, is really wearing on people. So just check in. How are folks doing? Get them connected to us if there's resources we can help with. We're waiting to hear from the state about some potential resources for helping with rent and mortgage assistance and other types of help. So stay in touch. I also want to mention that even while everyone is thinking about COVID and the economy, the census is really, really, really important. So if you haven't gone online yet to fill out your census form or responded to it in the mail, please do. The census happens every 10 years. So I know for folks who are young adults, maybe you've never done this before. It is kind of a weird thing that this is the way the federal government counts up how many people we have and how to sort out how much money should go to hospitals and school districts and roads and organizations. But it is the thing we do in this country. And so please go online, census.gov, and fill out your census form. It's so, so important. One thing we know about the census is that young children are often forgotten, aren't counted. And so what we're trying to do is count where people were, which address they were at on April 1st. So that's been a while now. But if you're a grandparent who cares for grandchildren part-time, just make sure you're talking with whoever has the children the other time to make sure that the children are counted in one household or the other. Or if you're a parent who shares custody with another parent, it's so important that these children get counted because that's what helps determine how much money is going to our early childhood services and school districts and things like that. So set time aside. It takes just 10 minutes or less to fill out the census online. I'm really, really, really hoping to get those numbers up. We understand that they've been down this year compared to 10 years ago because everybody's mind has been so consumed with just navigating the day-to-day. But the information is completely confidential. It's really easy. It's really, really important. And people often ask me, what can I do to help end poverty in our communities? And this filling out the census it seems too easy in a way, but it really can. It's the single biggest step you can take really to help address poverty because it's going to help us figure out how much housing resources, other kinds of resources to bring to our communities. On that, the last thing I just wanted to leave you with is that our mission at Mahabi Ottawa is about helping people with upward mobility. And so we try to be flexible at different times, with what's going on in our communities, try to approach this with flexibility and grace and just designing different programs. So as we continue to navigate COVID and whatever challenges it has for us going forward, please be in touch with us about what you'd like to see us do, like where the needs are, what we need to be doing so that we can continue to help people with upward mobility. We see success stories every single day of people who, even in the face of COVID, finishing their school degrees, getting jobs, getting promotions, getting additional hours, working on personal challenges that have kind of gotten in their way. And we're so honored to walk alongside people as they do this journey. But we need to know and are welcome to hearing ideas you have. So be in touch, take good care, reach out to your neighbors, fill out your census, wear your mask. We're gonna get through this together. Thank you so much.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Ottawa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.